How to dilate faster. As you approach your due date, your cervix will probably begin to soften and dilate in preparation for childbirth, even before you start to feel labor pains. Cervical dilation is typically measured either in terms of fingers. The obstetrician, nurse, or other attendant can fit 1, 2, or 3 fingers through the cervix, and then you are fully dilated and ready to deliver your baby, or in terms of centimeters, 10 centimeters is considered fully dilated. First-time mothers often dilate slowly, but there are ways to speed up the process. Want to make labor go faster? Go to step 1 below. Method 1. Stimulating cervical dilation naturally. 1. Walk as much as possible. Light exercise stimulates uterine contractions, which put pressure on the cervix and encourage it to dilate. When you walk, you will also help the baby descend into the birth canal, exerting the same pressure and leading to faster dilation. If your water breaks, your doctor or midwife may want you to stop walking. Always let your attendant know if you experience a rush of amniotic fluid from the vagina. 2. Keep your bladder empty. A full bladder inhibits contractions, which means less pressure on the cervix and sluggish dilation. Urinate regularly to avoid slowing down the process. 3. Sit on a birth ball. A birth ball is an exercise ball, firm but soft and filled with air. When you sit or squat on one, your pelvic muscles relax, and your cervix dilates more quickly. For maximum comfort and efficiency, sit on the ball with your legs spread apart, and support your back against a bed or a chair. 4. Consider nipple stimulation. When you or your partner stimulate your nipples, either manually or with a breast pump, your body releases a hormone called oxytocin, which will speed up cervical dilation. 5. Try sex. Having an orgasm will also cause your body to release oxytocin. It will, in addition, make your uterus contract. On top of that, chemicals called prostaglandins, which are present in semen, help the cervix dilate. All of this means that for some women, sexual intercourse is the most effective, and fun, natural way to dilate the cervix quickly. 6. Relax. Tense muscles can delay the progress of labor, obstructing the baby's descent and preventing the cervix from dilating. Try to stay emotionally strong and maintain a relaxed state of mind. If you are having trouble relaxing, try taking a warm shower, listening to music, or having someone give you a massage. Method 2. Stimulating cervical dilation medically. 1. Consider medications applied directly to the cervix. These medications, which are only used under a doctor's care, can help soften and dilate the cervix. Misoprostol, a prostaglandin, is sometimes placed in the vagina. More rarely, it can be taken orally, to soften the cervix. This particular medication is safe and relatively inexpensive, and physicians use it frequently. Dinoprostone is a similar prostaglandin, which can have the same effect. It can be inserted into the vagina as a suppository or squirted into the opening of the cervix. Hyaluronidase is an enzyme made from bovine testes. When injected into the cervix, it can soften it and help it dilate. This medication is sometimes used when a patient's cervix has not begun to ripen or dilate at all. 2. Ask your doctor about intravenous medications. Oxytocin, the same hormone that your body releases during nipple stimulation or sexual intercourse, can also be delivered through and for. This method sometimes causes extremely strong uterine contractions and other side effects, so talk to your doctor at length about the pros and cons. Method 3. Stimulating cervical dilation mechanically. 1. Consider a Foley catheter. A Foley catheter is a flexible tube with a balloon attached. When a doctor inserts the catheter into the cervix and fills it with fluid, the balloon swells, exerting continuous pressure on the cervix. In addition, the procedure separates the membranes, which results in the release of prostaglandins and faster dilation. This method is the most common way to dilate your cervix mechanically. 2. Talk to your doctor about laminaria. Laminaria is a seaweed that, when dried, becomes hygroscopic, that is, it attracts and retains water. When a doctor inserts laminaria into the cervix, it absorbs water and swells, exerting additional pressure and encouraging dilation.